There are many types of potential eye hazards. Flying debris are hazards to the eye and includes things like dust, dirt, metal, and wood chips. Flying debris accounts for about 70% of serious eye injuries. Liquid chemicals including acids and bases, chemical gases or vapors, and blood are potential eye hazards. Working with lasers or any type of welding emits harmful light rays. It's scary how many potential eye hazards are out there. Your eye could be struck or scraped and you could possibly end up with a scratch on your eye. These can be disturbed by activities like chipping, sawing, grinding, hammering, or even just strong winds. Debris could also be ejected from a power tool or fall from above. Objects could also swing into your face and eyes, or you could run into something. If there's a large object, it could cause blunt force trauma to the eye and surrounding areas. Your eye could also be penetrated. This can cause temporary or even permanent loss of vision. Objects like nails, staples, and even sharp pieces of wood or metal. These objects can go through the eyeball and cause severe damage. Your eyes could even be burned. This may be from a chemical or a thermal burn. A chemical could splash or even explode while working with it. Splashing can occur when working with any type of industrial equipment or cleaning product. Highly concentrated acids and bases can cause severe damage to the eye. The proteins in an egg white are similar to those in our eyes. Let's see the damage caused when a small amount of acid is added to an egg white to demonstrate this. Thermal burns can occur when working with lasers, welding, and can even occur from sunlight. They can burn the surface of the eyes and surrounding areas. It's like getting a sunburn on your eyes. You could also transmit an eye disease if you're not wearing proper eye protection. Blood is a potentially infectious material that could splash into your eye, as well as air droplets from infected person coughing or sneezing. Touching your eyes after touching a contaminated surface can also cause problems. These diseases are transferred through the mucous membranes of the eye. They may cause some redness or soreness, but could also cause a life-threatening disease like HIV or hepatitis B. Eye strain isn't an injury per se, instead it's an eye condition. What causes this? When you use your eyes intensely for long periods of time, they get tired. This happens when you look at things up close like a computer screen. It also can happen when you drive long distances, especially at night. Your eyes need time to relax just like your body does. Your eyes also need to blink often so they don't dry out. If you think you've developed eye strain, rest your eyes, try to reduce glare and bright lights, and use eye drops if needed. Please note, these symptoms are common to many eye conditions, so seek medical advice if needed. How can you prevent eye strain? While working, schedule breaks for your eyes using the 20-20-20 method. Every 20 minutes, look away to something at least 20 feet away for 20 seconds or more.